All right, you gotta enable attendees screen sharing.
Okay, give me 1 sec. Okay, so we live on Facebook. All right. Okay, I see you, Carrier, and T. Where you at? Okay. All right. So good
Can you
afternoon,
see me?
yeah, we're live now. So good afternoon, everyone. It is Joy of Body Integrity Fitness. We are live. I hope that you are enjoying this wonderful, beautiful day, Saturday. It was lovely and sunshiny earlier, and now it's raining, but it's still a glorious day. So we are continuing our COVID-19 discussion series. And we are just going to begin to explore how COVID is impacting many different areas of our lives. And so this week, we are going to speak to women who have chronic illnesses and diseases, and we kind of want to um, discuss with them how they have um, been impacted with COVID and how they are, how it's impacted them prior to COVID and now how it is impacting them now that COVID is here. A lot of people kind of don't understand autoimmune um, diseases and the impact that it makes on people, and it's very tremendous. Oftentimes, those who are suffering with autoimmune issues for many years, it is oftentimes misdiagnosed because a lot of the autoimmune diseases, they kind of mimic one another, and they mimic a lot of the other diseases that we kind of encounter in our lives. And so for a lot of them, this particular medical journey is very long and it's very tedious. Um, and it's very disheartening for those who experience it because they oftentimes don't get a good diagnosis off the bat. And to add insult to injury, there are not a lot of testing for a lot of the autoimmune issues that people have. Some of them are so rare um, that it just doesn't occur to doctors naturally to kind of think that maybe this is the issue or this is the problem, what's happening with the person at the time. And so again, they kind of get they're impacted and they don't get a diagnosis right away. And so that becomes an issue with those who are experiencing autoimmune issues. Um, a lot of times we don't even understand all the gamut or how many different autoimmune issues that people are with, because a lot of times people look very healthy. They don't look like they're in pain. They don't look like going through when they are dealing with autoimmune issues, um, unless you see some of the more manifested side effects of autoimmune issues. And so oftentimes when people with those issues, they're saying that they're in pain or they just don't feel well. A lot of times people have misperceptions about them. They think that these people are looking for attention. They think that that they just want somebody to look at them, that it's a lot of times it's centered around attention and attention. And so a lot of these times these people are pushed to the side or their symptoms are not taken seriously when they are indeed, they're honestly having an issue. Um, and because they look healthy, we kind of sometimes we kind of push those people to the side. It's like they always complaining or they always saying something hurt, and really it is. So, for example, myself, um, uh, I was diagnosed with endometriosis 5 years ago, and if anyone who knows endometriosis, the only way that you can be definitively diagnosed is if you have laparoscopic surgery. And that's the only way they can determine whether or not you have endometriosis. There is no test, no blood test, or if they go in, a pap smear or a sample of your tissue in, from your cervical wall, is no way to definitively tell if you have endometriosis or not. And when I tell you that my cramps and the way that I felt, people would think that I was over exaggerating. And I've often heard people who have witnessed other women who are going through, having endometriosis. They think that, again, exaggerating because don't nobody cramps hurt that bad. And they're not. And I can tell you that, my God, it gets worse when you have your cycle. And for me, I would say that as worse as mine was, because I developed a tumor, endometrial, which is why they had to do surgery because of where the tumor was growing. But let me tell you, my God, I had a mild case, as bad as it, and as much pain as, like, I was drinking ibuprofen, like I was going through bottles of, and I was on that strict every 4 hour limit that they give you. I was really at 3.5 because at that fourth hour, that ibuprofen had completely worn off, and the length of time that it took for the next dosage to kick in, the pain was just unbearable. And I mean, when my cycle came, I could not lift my legs to walk, wearing a soft girdle because it hurt just for my stomach to hang, in its normal position, where your stomach is. It hurt for my stomach to just be where it's supposed to be. I could not, it hurt me to lift my legs. So going upstairs, lifting my leg to get in the car, that was all traumatic for me during this time. And I heard, I know some women who had endometriosis and it resulted in them having a complete hysterectomy. But they used to bleed, when their cycles came, not only were they having a cycle out of their vagina, but their navels were bleeding. Um, you know, anybody who's had endometriosis, that sometimes it's painful during urination, it's painful to defecate. This is a very painful disease state. And I heard one commercial that maybe gave the best explanation of what it is to live with endometriosis that I've ever heard in my whole life. And it was a woman asking, living with endometriosis is like having barbed wire wrapped around your entire body. And every time you move, it hurts. So if anybody has ever been stuck with barbed wire just off of, general purposes, that barbed wire hurts, first of all. Like, it hurts bad. I don't care if you just barely grazed yourself on barbed wire, that junk hurts like really bad. And so to have your body wrapped in barbed wire and trying to move, that is exactly, the pain is, I'll just say that I ended up getting on prescribed pain meds from my doctor, from my gynecologist, to help me manage my symptoms because those cramps were that bad. And there are some women whose cramps were worse than what I was experiencing. And my cramps have stopped me like I was in labor. They have stopped me mid walking, mid sitting. I've had to breathe through my cramps. I have crouched over like it is a trip. So, my surgery, thank God it did help. But all of the doctor's visits, the poking, the prodding, that was not fun at all, you know. And so those of us who have autoimmune issues, there is a lot of poking and a lot of prodding all of the time because they're trying to figure out and get a definitive diagnosis for you. And oftentimes, a lot of people get misdiagnosed for many years. So I have two ladies here, two women here, two panelists who both suffer with autoimmune issues. Um, I'm going to allow them to introduce themselves, give you a background about their autoimmune issue, and we're going to take this conversation and go. So I'm going to have Talisha go first, and then I'm going to have Carrie go second. All right. So come on, Talisha.
Hey y'all. Okay, so my name is T Trigger and I was diagnosed with multiple sclerosis in 2004, June 2004, but I've known since May 25th, 1998 that something was wrong. Quick story behind that. My sister was going to prom and my mother needed a hairbrush. So I come up the stairs and go around the corner to go in her room and I slip and fell. And I had on my sister's Skechers sandals and I hurt my foot really bad. I thought it was just a sprained ankle, but days kept coming, weeks kept coming, and it kept happening, and years and yada, yada, yada. In and out the hospital from 2000 to 2001 and misdiagnosis. A nurse told me, you need to tell me what's wrong with you. I mean, it was just stupid. So I went to see a chiropractor. And I was telling him all of the things that I was going through. And he said, I think it's MS. So I said, oh, so then I told him one more thing. And he's like, yeah, I think you need to go get an MRI. Wrote a prescription, went to get the MRI. Sure enough, MS like symptoms. So I go to the hospital to go see my doctor. He was a very cold doctor, whatever. But I'm telling him everything, and me and my mom are in there, and he's like, I have to perform a test. I'm trying to be quick. I'm so long-winded. Anywho, that happened in 1998 when the first thing started happening. Then in 2004, I was diagnosed. In 2016, I started medical marijuana, and now we are here. Here we are today. Now, from 1998 to 2016, my pain went up and up and up. Like, the pain never stopped. The pain, like that barbed wire you were talking about, yeah, that's a part of the pain I was going through. But nobody ever knew I was going through pain because I never, you never murmur and complain. Nobody wanted to hear it. My sisters knew what kind of pain, my mom knew what kind of pain I was going through. But it was really terrible. So a couple people came to me and told me about medical marijuana. I'm like, yeah, right. I don't smoke. No, I drink. So I go get the stuff, and wait for my card. I get it. I go to the dispensary. I have no idea what's going on. I don't know anything about weed. So I get it. I roll up. I'm like, if I choke on this, because that's what I know from smoking, then I don't want any more. Sure enough, after a couple puffs, I choke and I'm mad. I go in the house. I'm sitting down. I'm watching Two Broke Girls. I'm mad. It felt like 10 minutes had passed, and it was probably only seconds. And then I realized I ain't in no damn pain. Let me go try this shit again. Ever since then, I have not been in pain. Well, okay, the pain, I had to keep smoking to keep the pain away. But ever since I started ingesting it and cooking for myself, which is a whole other story, I have not been in any physical multiple sclerosis pain since December 2017.
Nice. Okay, so I want you to stop right there because we're going to delve into that a little deep. Carrie, I want you to come on in and give your story.
So
Hi to everybody who is watching. I am back, and my name is Curia. I was diagnosed with multiple sclerosis about 12 years ago. Um, I have um, there's like different types of MS. So my story, real quick. There's always been something wrong with me. Since I was a kid, I used to walk into walls and trip over my own feet. But I had to have my the doctors broke my feet, and then I wore the inserts, and I would still walk into things and have accidents, and they would just say I was accident prone. When I really started having problems was late high school, college, and so at 20 or 19, I was diagnosed with lupus. One thing when you're with autoimmune diseases, you can be diagnosed with several different things. Having an autoimmune disease makes you more susceptible to another. But also autoimmune diseases tend to mimic one another, just like Joy said in the beginning. So there's no test for lupus. It's kind of like they rule out everything else and then they say you have lupus. So I kept getting tested because as you get new doctors, because every time you get diagnosed with something, they give you a new doctor. If you have lupus, you're going to get a rheumatologist. If you have MS, you're going to get a neurologist. So depending upon what you have, when they would send me to different doctors and I would get a different diagnosis. So finally, about 12 years ago, I was diagnosed with multiple sclerosis, with relapse and remitting multiple sclerosis, which is what pretty much most people get. Um, Although I'm gonna stay out of T's story, but I know that not everybody starts there. Um, so I was real depressed, and people started hooking me up with. I was very vocal about mine. I complained about my pain because I had never felt pain like this before. Um, my feet would literally be on fire, and people would say stuff like, "Well, just put them in some water," and I'm like, "Dumbass, it's not an actual fire. It just feels like fire. I don't know
Yeah.
what to do." So it was really hard. And what I have now, being an MS advocate and talking to other people, is the first couple of years are really hard when you have that breakout episode and you're trying to get adjusted. If you have relapse or remitting, you will have symptoms that run the gamut. I had an inability to urinate, but yet I could poop. I just couldn't feel it, and it would just come out whenever it wanted to, wherever it wanted to. I'm laughing, and one day it's just traveling down my leg. I don't know it because I can't feel it. Because I couldn't feel my sphincter. That's a bit of disgusting history for you. But at the same time, I couldn't pee, so I had to start using catheter. I mean, all of these things happened in the beginning. I couldn't walk. I had to go on a walker. First I started using a cane and a walker. Eventually, I was in a wheelchair. Then I spent a couple months at the Rehabilitation Institute of Chicago, more than a couple. I was there for like 6 months. And they got me up and walking, and it was a really great place. They got me up and walking. I had speech therapy there. I had to learn how to use my hands again. And a lot of the things that I learned back then, I still use now, because as I get ataxia, or as I flip over my words, I have to use a lot of the association techniques. But things have gotten a lot better for me. I always smoked marijuana.
Okay.
Started smoking marijuana probably in 8th grade. I'm not advocating that for children because my memory is complete crap. But um, but because I was working out so hard back then, and because I was smoking, it masked a lot of my pain, and a lot of my symptoms did not come to light until I stopped. I stopped smoking heavily um, in college around my sophomore junior year because it started to make me paranoid. And I started back probably in 2010, something like that. I don't know. I started back because someone suggested that it can help with the autoimmune pain, and it does. And now for me, I can't smoke regularly because it makes me paranoid. Um, And it doesn't matter for me if I'm doing sativa or indica or a blend. Sativa is better for me, but it'll still get me paranoid. So that has a lot to do with my mental health and making sure that that is okay. Because if mentally I'm someplace else, a lot of people with MS, a lot of us get depression. So if I'm having a moment, I can't smoke because the psychological pain is just as bad as the physical. You know, it really got me down. You know, it felt like when I had to stop working, and I felt like nothing. Like, what's worth getting all these degrees for, and I can't do anything. Um, Now that I'm walking on my own, people look at me if I take handicap parking, or nobody believes there's anything wrong with me, or because my symptoms, they ping ponged all over the place, like they do with a lot of people. You know, they're like, oh, you're faking it. And that was hard, especially coming from friends. But you have to understand that they really didn't know what was going on. I remember when I met T, it was really a blessing because she helped explain a lot of what was going on with me. And I, for lack of a better word, I say she normalized it. You know, her and a couple other people normalized it because this is our new normal, right? So it's not normal, but it's normal for people with MS. So with that, I stopped explaining to people, you know, I would get, well, why were you on a walker then yesterday, but you're not on, you know, you're not on one today. And, you know, for me, um, I had relapse and remittance, and then my own neurologist took me to secondary progressive MS. And now my current neurologist says it's just relapse and remitting. That's the type of stuff you go through with autoimmune diseases. Everybody has their opinion, so the doctors will give you their opinion because it's not like the test is gonna say, well, this is relapse and remittance, and this is secondary progressive, and this, you know, it doesn't work like that. They go by your symptoms and how severe they are at the time. So it was hard because friends would see me not being able to walk, and you know, just like you said, Joy thought I wanted attention, and I love attention. That's just not the type of attention that I wanted. You know, I like romantic attention. Anyway, outside of me, but you know, that was really hard. I got it from family members. I even had a family member call me a hypochondriac. I was pissed because I'm like, I can't spell hypochondriacism and you don't know anything about it. But that's what happens to a lot of people who have autoimmune diseases, and trying to explain to them that relapse remittance is just like it says, and secondary progressive is just a worse form of relapse remittance. I either relapse and it's constant and I'm having all these problems, or it can remit. And depending upon how active my MS can be, that could literally be from hour to hour for me. Usually, you know, it goes by days. I get up and see how my days go. I'm sleepy a lot. I can't exercise the way that I want to or the way that I should, because exercise is great for people with MS, but starting it off for the first time is extremely painful. There's always pain. I've been on prescription painkillers for years, and I just stopped treating my MS this year. My fiance and I are trying to conceive, so I you know trying to get off painkillers and everything, so to make that possible. But yeah, I just kind of take it day by day because today is the bed day, you know? I put on my neck scarf so y'all didn't have to see my neck fat. I wanted to be sexy for Joy's TV show. But I listen, as soon as this is done, I like you see I'm in the bed. And it's not because I'm lazy. It's just, I don't have enough energy. I have not had enough energy to make it through a complete day in years.
Wow.
And I always have to take a nap. There's not one day where I don't go to sleep in the afternoon, or when I was trying to work, I would literally fall asleep at work. I fell asleep on the tollway, tri-state tollway, and the Lord was definitely with me because a truck woke me up and guided me over to the side. But it has been very dangerous for me at times. So now I don't really drive now. I get driven around, but it limits your freedom. And it makes conversations difficult because I'm at the point where I'm sick of ask answering questions that I deem to be either too personal or just stupid.
So T, tell us about like some of your experiences with people. Do you have people kind of treated you in the same manner? Like, I seen you walking yesterday and today you got a cane. What's going on? You know, have you experienced those same types of things?
Never.
Okay.
I have everybody in my life. Like, I mean, I've met people who said slick shit to me, whatever. But my people, my friends, nobody has ever treated me, any different, ever accused me of lying. If anything, they wanted to understand, and I've tried my best to help them understand. Example, what it was told to me. MS is like an electrical cord. If you have an electrical cord, it starts to wear away. You get toward the wires. So that's what's happening. And by the time you get to the wires, it kind of gotta, it's off. So your nerves are like the wires, and there's a myelin sheath
Right. I
around the
was about to
nerves. So
say that
once that
it's
wears
the
away,
degradation. It's the
right,
degradation of the myelin sheath around your dendrites and your neurons, and they lose the ability to effectively communicate between the
right,
central nervous system, which breaks down your some of your motor movements.
yep,
Like it begins to just affect every aspect of your body in the
yep,
way that, like Carrie said, her inability, she had to use the bathroom, or in for one instance she couldn't use the bathroom, and in the other instance she was just going and not even knowing that she was going. So your body in a sense just loses all communication with the brain and how to
right,
properly function and designate those functions, right? That's basically kind of MS
exactly.
in a little nutshell. Okay.
The yeah, the signals from, like, if I was to think right now, it's least you get up and walk. Get up and walk. It ain't gonna happen because it's cut off. The spark, the wire has been exposed. The spark is gone. It doesn't work.
Mhm.
So I have my own. Okay, we'll get there.
Yeah, so because again, and I failed to mention that I went to both of these beauties are my Saluki sisters as well. And Talisha is my soror, and Carrier is a wonderful Delta lady. And so we were all down at school together. And so I I didn't really see any of those issues with either one of these ladies, not so much. Maybe I seen Talisha on her walker every now and again, but she was very active. Both ladies were very active. So, I never questioned anything because I didn't know the extent of their medical history like that now, like I do now. So it was never a big issue for me and from that perspective. But, you know, I know people that have sarcoidosis. I
My
know a
mom,
couple of dear people that have sarcoidosis, and they're very dear to me. And like you said, like both of you have said, but you carry those symptoms they span the gamut with sarcoidosis. I mean, oh my God, it
yeah,
they just it one day they got headaches, today they feel all right, the next minute they nauseated beyond belief, the
yeah.
next day they can't eat, the next day they real, then they got these
That's my mother.
migraines that won't stop. Like I know, well, one of my friends who has sarcoidosis, migraines will put her down for almost 2 weeks sometimes, and she went and got what they call this, the daith, right? She got that pierced or whatever, and it seemed to really help her with her migraines because she doesn't have them as much. Just reading her posts sometimes about, today is not a good day, sometimes she's like super cold, or other times she's burning up, and she feels like she got ran over like 12 times. Like And sometimes people, again, because today you had a, people thought you was lying about yesterday, or when tomorrow comes, they think they're lying, and it's really not that case. It just,
let me interject for a second, because I really love what you said about it being an electrical wire, kind of like with a short. A lot of these diseases are known as snowflake diseases. MS, sarcoidosis are really snowflake diseases. So let me throw this out. It's really hard for people to understand something that they don't get, and the symptoms change. Nobody's MS is the same, right?
nope.
So I know T, she knows me, but our MS is not the same. The stuff that happens to me, I remember calling her damn near in tears, like, what is going on? I can't pee and blah, blah, blah. And she's like, girl, that has never happened to me. I do not know. And, and with love and with care, don't get me wrong, but I'm saying, just because you have two people with the same diagnosis does not mean they're going to have the same experience. We do have some things that are the same because they're categorized under MS, just like the pain and what we have is nerve pain. And I guarantee you that's the worst damn pain in the world. When your nerves, like, imagine a toothache. And now if you got a bad toothache with an abscess on it and it's so bad that you can't, all right, now take that and put it all over your body. So that's nerve pain, because typically a toothache is going to induce nerve pain. Mm-hmm. And if you imagine the worst toothache, and now put that where your toes are, that is how I kind of explain it. But by snowflake disease, no two snowflakes are the same.
That's
no
right.
two people with sarcoidosis are the same. Like what you're explaining, your friend, well, my mom gets horrible headaches too, but she also has gotten skin cancer on the nose because of her sarcoidosis. My mom is really rare. Most people get sarcoidosis in the lungs. Mm-hmm. My mom, tip of her nose and in her brain. She has neurosarcoidosis. Most don't get neurosarcoidosis. It was when she was diagnosed, it was so rare at the time, they sent her to the Mayo Clinic to study it before they knew exactly what it was, because people get sarcoids in their lungs.
Yes.
People with MS, I know people who are completely wheelchair bound, cannot stand up. There are people in my group who are no longer able to speak. Some people just have foot drop syndrome where they're tripping all over the place. My ex-boyfriend, David, he is confined to a wheelchair now. He cannot stand up. And me, while I will explain what's going on with my disease and I will talk to you about it, I don't want to confuse it with complaining, because earlier I didn't understand what was going on with me and I did complain because it's very painful. But now, I'm feeling really lucky that what I deal with is not as severe as just even other people in my life. Mm-hmm. And when it does get bad, I will typically tell people I'm having a bad day and just kind of just fold into myself, because I've reached the point where I realize there's nothing that anybody else can do. And there's all I have all the drugs in the world. Don't come rob me. I'm not telling y'all where I live. But I've got Percocets, and I've got Oxy, which is the same drug, but it works on a different level. I've got Xanax, I've got everything, because my MS has gotten so bad. However, the only thing that has really worked on the nerve pain is the marijuana. Do not work on nerve pain. They work on the other pain that you get, because guess what? You don't just get nerve pain. Yes, when you get MS, you really get a present. You get other pains. Shit start hurting. You don't even know what it is. Like, you get random pains and it's hurting and you can't kind of grab where that is. So it's the gift that keeps giving. But I have chosen, after knowing people like Talisa, several of my girlfriends, the people who are in my MS group, for the last year, the beginning this year, I've started to eat healthier. I stopped taking my MS drug because it was literally making me sicker. I was on I was on Oxy. I was on that too, but I was on Ocrevus. And I have a gross, so about MS being different from person to person. I have a girlfriend who I won't mention her name because she's not on here. Beautiful woman. She lost her sense of touch and feeling. It was gone for 12 years. She was on Aquavis 1 week and she got to hold her goddaughter, who was 12 at the time. And it was the first time she had ever had feeling, was when she hugged her. So, you know, she got her feeling back. Now she can hug people, she can touch people, and she can feel it. But she wasn't able to do that for so long. So from person to person, you know, I made the point, we're talking about the same disease, and it's the same with a lot of them. With, and like I said, I know for a fact with the, say it for me, Joy, sarcoidosis. Sarcoidosis has a lot of the same symptoms as MS.
Yes, it does.
I was diagnosed with lupus. I have been diagnosed with lupus, told I don't have lupus, and then diagnosed with lupus again. And people who have lupus have, we can get lesions on the brain, but they do not get lesions on the spinal cord. People with MS, we get lesions on the brain and the spinal cord and other places, because I have lesions on my kidneys, right? So knowing these little nuances, we know this because we have the disease. Lay people have no reason to know this.
Right.
Can be a little cruel. It's a little hurtful. Now, the friends that I share in common with T, like yourself, I don't really have no problems with. I do have some people ask me questions and compare us. And that's one thing that both of us don't deal with. Don't compare us. You know, we got
different. The experience is different. But I think it's like that for all autoimmune diseases, because
exactly
even people with fibromyalgia, like they just hurt all day, right?
And then we'll get into that, because I don't believe that fibromyalgia is even a real disease. And I'll tell you, every single person I know who has a definitive, like an MS or sarcoidosis, they all start off with the diagnosis of fibromyalgia. And then a couple years later, it's something worse. So in my mind, and the research that I'm currently doing, it seems to me that fibromyalgia is a precursor to something worse.
To MS. Well, because
not just MS. Not just MS, but just another autoimmune disease. I was diagnosed with fibromyalgia when I was 10 years old.
Well, it is another neurological condition that affects the entire nervous system, which in turn affects the entire body. Right?
Yeah, I get that. I'm not saying it's not real, because it used to be an idiopathic disease that they would just throw to people if they didn't know what was going on. They say you have fibromyalgia. I'm not saying it's not. Maybe I did say it was. I missaid it. I believe that it is a precursor to some. I've never known anyone. I haven't talked to anybody who has had.
I know a couple of people with fibromyalgia as well, and so
talk to them for 10 years and make sure that it's not. You know, it doesn't turn into. I'm just saying, it seems to be a precursor to something else. From what I've seen. Not that it's not real, it's definitely real. It just seems like it develops into something else.
T, you got to jump in on this conversation. So,
I'm
set up. Go ahead, T.
Well,
come on in.
Well, I'll say something about pharmaceutical drugs. So when I was officially diagnosed and I met with the doctor, he gave me 3 choices. You either can do injections once a week, once every other day, or once every day. Of course, I chose the once a week. You know, I thought I could take a pill or something, but I had to do injections. I had to have a nurse come out and teach me how to do it and everything. The very first night I took my injection, I came to my dad's house to spend the night, and my sister and brother were there. And I did not sleep the entire night. I laid stiff as a board. I couldn't do anything for the entire night. Wow. So from then on, every time I would take my medicine, I would always do it on a Tuesday. I would have a nurse do it, because after 6 months or a year, I couldn't do it anymore because my leg kept jumping or whatever. But I would drink just to go to sleep, what appeared to be going to sleep. Now I did the Evanex for about 2 years, And I
Mhm.
stopped doing it because I felt I was worse on the pharmaceutical drug than I was off of it. So I just remember, I don't know why I was never the kind of person who took pills for headache. I mean, I did if it got really bad, but I could deal with it. So I
Mhm.
didn't do pharmaceutical drugs. So after 2 years, it wasn't working out. I quit. I did
Mhm.
steroid therapy in 2009, and that was for a week, and I will never do that again. I will never do any pharmaceutical drugs ever. That's just me personally, because I have my own gripes about it. Because I'm in this group, the medical cannabis community group,
Mhm.
and I've read so many stories of people who are on this one drug, but then that drug don't work. So then the doctor's like, hey, we'll do this one. Hey, try this one and up your dosage. I have a major problem with that. I don't agree with this. So I chose not to be a guinea pig. So
Okay.
right now I'm just self-medicating with holistic medicine, which is marijuana, cannabis. I really don't like the term marijuana, but cannabis. So that's all I do. I eat it, I vape it, I smoke it, and then we'll get there too. I do
So
everything.
so
I
so
make lotions, I make bath bombs, I do everything.
so now, which brings me kind of to my next point. And I just wanted to touch on one thing. When you said about that nerve pain, Carrie, how the pharmaceutical drugs don't numb it, but the cannabis did.
Marijuana.
Yeah. So what it brought to mind, because like I told you guys last week, we talked about CBD oil, right? Which is another derivative of the marijuana plant, but it doesn't have the THC, um which
Right,
gives
right.
Yeah.
the
Give you the
high,
high.
right?
Right.
And so when I think about that, it's all based on our own cannabinoid system, endocannabinoid system within our bodies. And so when
Girl,
you
you been
said,
doing some homework.
Hey, she's something.
when
Oh,
you
Dr.
talked
Joy.
about how it nothing worked for that nerve pain but the cannabis, it made sense
Yes,
how
yes,
it, because it connects the endocannabinoid system within
yes.
Well,
us
let's
that
talk CBD
helps.
now. CBDs typically
But
do not work for me, but
wow, okay.
CBD itself, and I've tried different. I've only tried like maybe 6 different types, but
Mhm.
I have to have a 1-to-1, because like if I get a marijuana flower, that's perfectly fine. But
Mhm.
like I was saying earlier to you guys when we were doing girlfriend talk, um I'm lazy. I like to smoke vapes. So when I get a vape, I have to get a 1-to-1 that's CBD to THC. And the part that gets you high and the part that doesn't.
Mhm.
And because just doing straight the THC by itself, it doesn't stop my pain. So I have to have a 1-to-1. But when I buy like the lotions, or like right now, 'cause today hasn't been the greatest day. So I'm having a lot of leg jumping, a lot of leg pain. And I have a CBD cream, but it's doing nothing. Uh
Wow.
Typically, like on some days it has helped with, some small level pain. But
Mhm.
with my vapes, it has to be a 1-to-1, or I've even tried a 2-to-1, but I cannot have the
Just
CBD
straight
separated
CBD oil.
from it. I have to have it the way that God made it. Or
Mhm.
I'll get the flower and it's got all of that in it, and I'm good. And I only need to smoke. For me personally, I don't need to smoke a lot
Mhm.
to calm my pain, because what's it gonna do is, like, if you know me, Joy, I'm queen of the insomniac club, and it allows my body to rest so that I'll go to sleep, and it doesn't even stop the pain, it calms it down enough. Like
Where
right
you
now my feet are on fire, but it's not a roaring fire. It's I can handle this if this was MS, baby, I'd be a breeze. But I know it's just gonna get worse. So I'm gonna smoke after we're off of this Zoom so that I can function. But
right.
if it was just like, oh, people were like, try this CBD and you won't get the paranoia and all of that stuff, but it does nothing for my pain. But
But
separate the two. If it's
uh-huh.
just THC, that's not gonna take care of it either. but T is more of a professional on the types of weed
Yeah, that's what I was
and
about
what.
to say.
Yeah, that's who I
Thank you
go to
for the
with a lot of
introduction. Thank you.
questions.
Thank you.
Yeah, Your Royal Highness T Trigger, could you please explain? Um,
Yeah. So that's what I was going to ask you, Talisha. Like with you, did you start with CBD and move up to cannabis, or you just also went right to cannabis and you got your relief that way, or do you alternate? Do you use, because they also have, I guess it's a two-part question, but I want T to ring in first. They have those, medical medicinal, the oil rolls. Um, have you guys tried that, and is that successful? So come on, T, I want to hear you first about the weed and what was how did you find your dosage amount?
Well, a couple of potheads talked me into getting my card. I wasn't a pothead before, but then a couple more potheads took me to get my first purchase. And of course I purchased weed. I don't know how to roll. I don't know how to do anything. It was actually done for me. And then I smoked it. Dang, I lost my thought.
It'll come back. So I was asking you about your dosage, about how did you know your dosage?
Well, okay, when I first smoked, I had no idea about dosing or anything when I first did it. So I could have took an edible and been completely thrown off like, ugh. But I smoked, and the thing with dosing, okay, I want to get ahead.
No, come on. It's a double part question. So
The thing with dosing, like most people who don't smoke and they take an edible, that's the wrong thing to start off with or do it a couple times, because you don't know how many milligrams is in that brownie or that cookie or whatever you're ingesting. And that's going to shock your body, not in a bad way. You're going to make yourself think it's in a bad way, but it's not a bad way because weed can't kill you.
Right.
And I'm not saying
I had an edible and I was high for 2 days, baby.
I'm not trying to be cavalier or, with people who I quit. I quit.
Hey, why you quitting? What you fumbling with? Come on, girl.
Because I don't want to say anything wrong because I think
you're not saying anything wrong.
Cannabis is misunderstood. And it's so unfortunate that it's misunderstood because most people can get a benefit from just using the lotion. You mentioned the oil. I make this stuff. So of course this stuff works for me. I got some lotion I made that banged my back out, like not banged my back out, that was gross. That straightened my back out. But yeah, I only use cannabis. I've tried the pharmaceutical drugs, and it's crazy because if I tried it, they're gonna put me on something stronger and stronger and stronger, and my body is not made for that. My body was made for this cannabis that God put here before we got here. So okay, if this is my belief, this T's belief. If I believe that God put stuff here for me to have, it took thousands of years for God to figure out that we knew how to make medicine. He didn't put it here before. That's just like if your parent, I'm going off on a tangent. I quit.
You're fine.
You were fine, T.
I'm just going off on a tangent. I'm so passionate about cannabis and its benefits, and then I'm so passionate about people getting it right because a lot of people have it wrong, especially in Illinois with the laws and what you can and can't do. And then the recreational versus the medical, is so many misconceptions about that. And I want people to understand and stop believing the government. Just why do you think you don't like it? You don't like it because you've ever tried it. I've experienced this stuff. I've experienced
and
this.
It's helped you, right? And so, yeah, it's been very beneficial.
I'd rather something holistic that will not hurt me than take something that's going to end up hurting me. And then I've read too many stories of people taking pharmaceutical drugs and happen to up them and up them and up them, and then end up on the really bad drug. Now I can't think of the heroin, but they have to take that and then they're addicted. Yeah, that's the word.
That's what you're thinking of.
That's a terrible addiction. And I'd rather not become addicted on pharmaceutical drugs. That's just my opinion. I know I don't went all around the mulberry bush.
But how often do you smoke, T? Or how do you have a regimen? Like you smoke in the morning, you eat in the afternoon, you rub your lotion on at night. Like, what's your regimen?
The question is, when do I not smoke? Right now, I'm not smoking. Right now, I'm not smoking. But when we get over here, I'm smoking. Well, I have my vape pen, but I'm not doing that currently.
What about you, Carrier?
I smoke whenever I need to. If I feel a pain, I smoke. I mean, it's not. I don't have a regimen like a pill where you take one in the morning.
Right.
But I smoke, like, there's always marijuana around my house, so I keep weed, and I've smoked probably like 4 times a day. I smoke out of hitters and bongs. So, but I love wax. That's probably about my weed making me paranoid, because I like to mix wax in with my weed, and I'm totally Lucy in the sky with diamonds when that happens. But to get back to your question, I smoke whenever I feel the need to, and I've gone a day without smoking, and some days I have to smoke all day, but it's not like I just need a little at a time. If I was to roll a blunt, it would probably last me all day, if not 2. But because I just prefer to pack a little glass bowl and then smoke as I need to. But I'm now learning about rub-ons. I'm going to I'd have to defer all of that to T, but I will say that I will be making an appointment to give me some lotion, because if you got a lotion that works, like, one thing I will say, I've never bought an edible from the dispensary that worked for me. Never.
Really?
You cannot give me, because they can only sell 100 milligrams, and I can't take 10 milligrams of weed. That's not gonna do anything. So I spent $25 on this little pack of candy, and I got to eat it all at once to get 100 milligrams of weed. So I don't bother with that. I have to get somebody who is a cooker, who knows what they're doing, and I have somebody who does that. And that's the difference. That I've had a cookie that'll last me a week. I can have, I just take little pieces off of it. But for me, dispensary level stuff, as far as what I can get in Illinois, let me say that, and their candies, that doesn't work for me. That's just me.
What about you, T? What does the dispensary stuff work for you, or you have to also count up the ante?
What don't the dispensary work for me? I do mostly THC. Now, there's a difference between THC and CBD, which you pointed out. The high is with the THC. Some people don't like it, but for my pain, I need THC. CBD does not take my pain away. I do everything. I have not tried anything at the dispensary that did not work for me, unless it was just CBD.
Okay. So T, again, that just shows the difference of intensity of the levels of MS in between the two of you. I mean, because for you, Carrier, the dispensary is like really literally eating candy, and for you, T, it
I don't eat the candy.
No, I'm saying it's like eating candy, like really. I'm making an analogy.
The edibles, just the edibles.
Okay.
Yeah, the edibles.
But it does the effect. My point is, the effects for you guys are even different on those levels, just to help people understand that even though these ladies are suffering with the same disease state, because of I'm going to just go so far as the genetic makeup and who they are, it's affecting them in different ways. And that's why it's their disease states are different, right? Even like I said, for me with having endometriosis, my endometriosis is much different than someone else's endometriosis, and it's controlled differently. And so, the again, people with sarcoidosis, like you pointed out, Carrier, most people have pulmonary sarcoidosis, but your mom's is different. Hers is, you said, neurological. So, everybody's autoimmune system is a little different. There's rheumatoid arthritis that people don't realize that it is an autoimmune. It is
Oh, yeah.
classified as autoimmune. My endometrium.
Speaking of rheumatoid arthritis, I don't mean to cut you off. Finish your sentence. I'll get to it.
No, I was just saying, even my endometriosis is classified as autoimmune. Polycystic ovarian syndrome is classified autoimmune. So there are a lot of disease states that people are dealing with that are classified as autoimmune, and you don't even realize it. And it's just because your manifestation of your disease state is not as highly impactful on your life as somebody else with the same disease state. What were you going to say, Talisa?
It's so funny. It's raining. I From 2002 until 2016, I did not sleep. And especially when it rained and thunderstorm, my sister would get up in the middle of the night and come in my room to make sure that I was okay because she knew I couldn't sleep. I did not sleep. I would drink just to sleep. I would drink just to pass out to go to sleep. So that's how bad it was. And then the first time that I did smoke, I slept like a baby. I couldn't believe it. Ever since then, I sleep like a baby. And it's God's medicine. Like, who else did this but God? Anywho, so arthritis, and so medical marijuana helps with cannabis. With insomnia. With arthritis, you have lotions you can do. A friend of mine, she was diagnosed. I know I'm gonna pronounce it wrong. Triaminogel neuralgia.
Yeah, that's
So
yeah,
she had to learn how to walk
that's a
again.
bad one.
Yeah, she had a big knot on the back of her neck. She did RSO oil. That's a whole other thing that
It's
we'll get into.
trigeminal neuralgia or something like that.
Yeah. She did Rick Simpson oil. Now she's better. She can walk better again. I mean, she can walk again like regular, but she didn't have to learn how to walk all over again. It just, the swelling went down and she can walk again, and she's doing much better. She still has to use the cannabis, but I'd rather use cannabis every single day of my life. And nothing's wrong with me. Nothing else happens to me to have to use pharmaceutical drugs for the rest of my life and have to up them and up them and up them and destroy my body that I claim, I'm trying to take care of.
Uh-oh, you broke up, Talisha.
Uh-oh, am I
Okay,
still there?
there you go.
My last word was no. I'm so
No,
dramatic.
but it's okay. So we're gonna get ready to bring our conversation to a close. Is there anything in particular that you guys would like to leave with our audience before I give our last word?
Here, you got the floor.
Girl, I was giving it to you.
Well, I'll say this. There are a lot of misconceptions, myths about recreational medical. It's better, in my opinion, to have your medical card because, for instance, there's this one thing called Rick Simpson oil that it's RSO that is available only to medical marijuana patients. And what that is a very, very concentrated form of the cannabis. And that's like the medicine. That's the stuff you got a fever, you got a tummy ache, you got a migraine, you got anything. If you don't want to smoke this stuff, take this. It will knock you out. And then you go to bed and rest and do your thing and you be better tomorrow. But that's not available to recreational. And recreational needs is especially for things like PTSD, insomnia, arthritis, whatever. So yeah, I forgot my thought. Anywho, but I'm gonna go into the gun laws. There's a lot of misconceptions about concealing carry. Yes, you can still have your and your medical marijuana license in Illinois. That is a whole lot that people keep saying. I don't know why. I don't know why it's me, but I know, and I know the people who know these things. But you can still have them. You just cannot go to a big seller like a Cabela's and buy a gun. You can privately buy guns. You can, conceal and carry or FL. I don't know the gun. FFL. Yeah, that thing. But yeah, you can still do all those things. And I don't think if you get pulled over by police, they're not supposed to know that you have your card. So that's another lie too, that the police know that they don't know. So yeah. Oh, and check me out. No,
Hello?
Oh, get back on here. Check you out where?
T?
Oh, I'm
Check you
at
out.
420. Check me out at 420 as a kite at gmail.com. I'll be posting everything that I'll be doing. I'm actually having a giveaway on the 25th, which will make 22 years of me going through MS, and I have a heck of a story that I'm going to tell over however long I tell it.
Okay. Very
That's
nice.
great.
Okay.
That is great. Um, I would just say, when you're dealing with people with autoimmune diseases, just don't judge. You don't know and whether, no matter what it is, lupus, endometriosis, MS, everybody's is different. So, you know, just like everyone is different, you treat them as an individual with different problems, and don't categorize us. And I don't have a problem with how anybody chooses to treat their MS. Um, Honestly, when you get it, the doctors will scare you into getting on medicine. One reason why I took it for so long is because, like, I talked to T before she started marijuana, but she was already off of medicine, traditional American traditional Western medicine, right?
Mhm.
So I was newer to it, and I had been scared because the doctors are like, "Oh, if you don't take it, you're going to get brain loss or brain shrinkage," and these are things that are real with MS, but you know, there's nothing to say that you're not going to get that anyway.
Okay.
So I don't have, I believe in individual rights. However you want to treat your disease, disorder, whatever, do that. But don't knock the next person for using what works for them. Right now, I'm on a combination of holistic medications and pharmaceuticals because unfortunately, you just can't come off of opioids. You can't just go cold turkey. You could kill yourself. And I've had to have a step down, and it's really hard to get off, but it's my heart's desire to do so. So I mean, check in on your people, if they're having a hard time, because it's raining, so that's probably why I'm in pain. So now I've learned some more stuff about marijuana. I definitely need to have a private conversation with T. I'm gonna need some of that oil. That that stops
Ma'am,
everything.
ma'am,
Yes,
ma'am,
ma'am.
I do not sell anything. I
I
do
did
not
not
have
say
my
bye.
infusion license.
I said conversation on
That
what to get.
conversation. She didn't say bye. She just said
You're
she
right,
wanted
but
a conversation with you.
you're right. I just heard back because yeah.
Yeah. So, with that being
If I
said,
have a card. Oh, I also want to say I have a gun card and a dispensary card. Uh, I do, because I believe in shooting and I believe in smoking, and I've had no problems. I was originally told that I was going to have problems. I was originally told that I couldn't get my conceal and carry. Um, I guess those people didn't know what they were talking about, and that was at the gun store that I used to use. So
mhm,
I haven't had any problems so far. That's my 2 cents on the matter. But
all
thank
right.
you for the opportunity to come in and talk about this. Lastly, real quick before you go, I just do want to say how it has affected me with COVID. Um, I am really careful about where I go out. I wear a mask. When my fiance comes home, he has to disrobe with all his outside stuff, and and I'm sure because I have a weakened immune system, and I'm not on anything to protect. Although the medicines for MS actually help, they weaken your immune system even more. So it's
Mhm.
probably, my immune system is probably better now than it was when I was taking Aquavus. However, yeah, Aquavus is an immunosuppressant. So I'm just really careful because it is easier for us to get sick. I always say if you got a cold, then I'm gonna catch the flu. So yeah, that's how I am coping through COVID.
Okay.
Social isolation. So nobody come to my house.
Understood. T, did you want to give your position on COVID and how it's affecting you before we go? Before I give last words.
Okay, cool beans. Well, I've been quarantined since 2002. So, I mean, I could still go outside and stuff, but I ain't been nowhere. This is a breeze for me. To being at home, I don't care to go outside. I'm a loner, especially since I smoke now. I'm really a loner. COVID, my father is an essential worker and I live with him. I'm not afraid at all of catching the illness. I actually, I'm not worried. I'm not worried.
Okay.
So COVID is not, I'm very aware. I'm not saying I'm going out there being, what's the word?
Careless. Careless.
Being, what's the word?
Careless.
Yeah,
Careless.
careless. But
Mhm.
yeah, it's no effect because I don't put myself in that situation. So I'm good.
Okay. So I want to thank these ladies personally, first of all, for their candidness in sharing their personal journeys with these autoimmune diseases and their states and their journeys. Um, because, again, people who have autoimmune issues, we have to be cognizant and be aware that there are a list of symptoms for a reason. And that is because people who suffer with these different diseases, they don't all have the same symptoms. Everybody has a mixture of symptoms, and there are varying degrees of these mixtures of symptoms that they experience. So while someone may be in constant pain, someone else may be in sporadic pain, and someone else may not have pain at all, but they can't walk. Um, and so we just have to be cognizant of issues. It's better to ask than to assume that you know about a person's condition. Um, like for instance, if you see somebody walking regular one day and then 2 days later they're on a walker, don't assume that they were lying. Um, and if you have um, a relationship with them, and you feel comfortable, just ask them. That's the best way. And it alleviates the awkwardness, and it alleviates your assumption and your misperception of them and their situation, because these auto immune disease hit differently. That doesn't mean that they're having the symptoms every day, all the time. As you heard, um, these symptoms come in cycles and they come at different times. And one day is better than the other, or they may have a series of days, or even weeks, or even months, or even years that are better than others. That doesn't negate that they are dealing with these symptoms and these issues. I mean, Carrie's story, she was in rehab having to learn how to walk and have precision hand movements and learn how to talk for 6 months. Then she was able to walk again. That was over a course of a year, because she's in rehab and now she's out. And so, you see the difference. They talked about their brain fogs. They talked about, trying to reassociate words when they're trying to get their points across to us. And so I'm just saying, exercise some compassion, exercise some empathy, because you never know. Autoimmune system, is not all autoimmune issues are genetic. Some of them happen as a happenstance over life. It's one of those mutations that we talked about that happen over a lifespan. So, some things show up right away, and some things, they take time to exhibit themselves. And so, I would just encourage you to keep these points in mind. I would encourage you to like this video, to share this video with someone else. If anybody has questions or comments that they didn't feel comfortable um, expressing on air, they can always inbox me via Facebook Messenger if they have it, or you can always me at bodyintegrityfitness@gmail.com. It's all lowercase letters, no spaces. And so I just want to open this conversation I want us to keep in mind, again, as Carrie has said, their immune systems are compromised because of their medication, because of what they're dealing with. Be considerate. COVID is an invisible, just like immune diseases. You can't see it. You don't know when it's going to strike. You don't know how it's going to strike. And so it's just to be considerate, if not considerate to yourself, be considerate of others. So I hope that you've enjoyed this discussion. I hope that you enjoy the rest of this day. Tune into us next week at 3:30 p.m. Central Standard Time, 4:30 p.m. Eastern Standard Time, where we're going to be discussing music and its impact on COVID. Invite someone and enjoy the rest of your day. Goodbye.
Joy, that was great.
Wait, we still on Facebook.